What is the current recommendation for mammograms in Canada? It seems to be changing every few years. I think some people might be confused by this. Could you clarify this for us?
Absolutely. So it's right for people to be confused because different provincial screening programs have chosen different targets. Numbers that are usually thrown around is starting at age 40, or there's some controversy and says, well, let's start at age 50.
Mm-hmm.
I think based on the best available current evidence, screening mammography should be started at the age of 40 to about the age of 75, because that's the age range that we start seeing an increased risk. And the second question that's usually a bit more controversial is, well, how often should I be getting a screening mammogram?
Right.
And the answer to that is also a challenging one because screening recommendations or screening guidelines are confusing that matter. I would say in general, every 1 to 2 years would be the appropriate time for a screening mammogram. Now, I think that when we approach screening, we need to start getting smarter about it. And what I mean by that is recognizing that there's a general recommendation of starting breast cancer screening at approximately age 40, doing it every 1 to 2 years, but trying to figure out what my risk is, individual woman's risk of developing breast cancer is. And there are screening tools or risk calculators that can really help out with that. So knowing some of those modifiable and non-modifiable risk factors and how it pertains to the woman or the specific patient at risk is really helpful in sort of deciding or designing what the optimal screening program should be.
Yeah, that's interesting. When I was studying for this interview, I actually went onto a website from the NIH, and there's actually a screening tool on there where you put in some information. One of the things I couldn't answer because it had to do with the BRCA1 versus BRCA2 results, right? But it came up with a percentage of risk for me. And I thought, well, you know what? If someone's concerned, they could even do this themselves, take this to their GP or something and just say, listen, maybe we should screen more, earlier or not, or something like that. So, I mean, even people can even do this at home, or I just thought it was a really interesting tool, and these are accessible online even sometimes.
Yes.